All right, so we are recording, and thank you all for joining us. For those of you listening at home or via phone, please press *6 to unmute your line or *9 to raise your hand. We are using the Q&A function of Zoom, so we can assure that we address all of your questions. There is closed captioning, and recording the slides will be sent as soon as they are available, along with our next invitation for next month's stakeholder engagement. So welcome everyone to the HCPF, BHA, CDPHE, Behavioral Health, Secure Transportation Stakeholder meeting. Today we will go until around 5 o'clock. Our agenda includes welcome and introductions to all members of our team. And then CDPHE will be doing data collection requirements. And then I'll review some of what we're doing over at HCPF, next steps and timeline, and then we'll open it for questions and answers. Introductions are, hi, I'm Megan Morrissey. I am the Behavioral Health Secure Transportation Policy Advisor. I work alongside Emily Holcomb, who is the Mobile Crisis Policy Advisor for HCPF, and John Lentz, who is our Wraparound Services Unit Advisor. We also work closely with the Behavioral Health Administration, Megan Lee, who is the manager of the crisis services over there. And I'll pass it over to Kara to introduce their team.
Yeah, thanks so much, Megan. Appreciate it. I'm Kara Johnson-Hufford. I'm the Interim Deputy Division Director over at CDPHE for the Health Facilities and EMS Division. I know Amber was kind of en route and might not yet be jumped on, so I will introduce her. Amber Vietanen is our Data Systems Section Manager within our EMS division here. And then Monica, I think you are on as well.
Hey, Kara. Yeah, Monica Billig here. I am a policy advisor with the Health Facilities and EMS Division.
Thanks, Monica. I think that's the CDPHE crew. Back to you, Megan.
Awesome. So, bear with me. There might be a lag in our passing things off. Okay. Off to the races with CDPHE data collection.
Perfect. Thanks so much, Megan. Appreciate it. And I will do my part to kind of set the scene, likely share some background and a number of slides that hopefully many of you have already seen, and then hopefully to buy Amber time to hop on. So next slide, please.
I'm here. Sorry.
No worries at all. Thanks, Amber. Perfect timing. So just to give a little background, like I said, I'm hopeful that many of you have heard this kind of shared before as part of previous slides, but this is just setting the background as to the work itself, the regulations, and then I will hand the baton to Amber around just the one piece that CDPHE maintained with regard to the data collection. So just for background, the Secure Transportation Services were a catalyst or came from House Bill 21-1085, obviously from the 2021 session. And that bill really was in an effort to create a regulatory and service system for the provision of services of secure transportation for individuals experiencing behavioral health crisis across Colorado. Many of you will know the service has been provided for a long period of time, really across 3 different provider sectors. It's really provided by the behavioral health industry, if you will, community mental health centers and others. The other side of the house, if you will, would be EMS and ground ambulance agencies. And then in the middle or thirdly would be private security companies that provide this service. The intent of the legislation was really to provide a minimum set of standards or create a set of standards for that service to provide a patient-centered approach, really informing more trauma-informed care practices, if you will, creating greater accountability and parity for that delivery of service across the state. Additionally, it was important to free up resources to create really a more effective alternative for this service, particularly to, say, traditional ambulance services or law enforcement. Next slide. Yep, perfect. The 3 buckets here. So this ultimately details the statute went through and assigned kind of 3 responsibilities to 3 different entities. So the first role was that of ours at CDPHE, was to develop those minimum standards for the services. And we had to do that by July 1, 2022. We were in front of the board and those were adopted in June of 2022. The second piece, and really kind of the greatest crux, if you will, if you wouldn't mind, thank you. I know it's sometimes a jumpy button, right? Ultimately is that of the counties, and counties really were responsible and are responsible to ensure compliance with the standards and create that licensing and certification, or permitting rather, of the service no later than January 1 of this year. They also were given the authority to set fees, license permits, renewals, all of the above. And then the third piece is our partners here at Healthcare Policy and Financing for creating the benefit or reimbursement of the service. Next slide. No worries, thanks, Megan. So I know many of you were part of the rulemaking process with this. So again, I think this is just recapping that work, but we at CDPHE worked closely really with a diverse group of stakeholders, many of which were providing the service, which was super helpful and important for that informing of those regulations. That work began in September, the fall of 2021, and was wrapped up by March of 2022. Like I said earlier, it was behavioral health agencies, grand ambulance agencies, security companies, and many other sister agencies, consultants and advocates in that line of work that really helped us through that stakeholder process, ultimately informing the regulations that are within 6 CCR 1011-4. And I think if they're not linked in these slides, we can certainly provide that link here momentarily as well, ensuring you all have access to those regulations. And those again were adopted by the Board of Health this last June, early summer. Next slide. So as I kind of mentioned earlier, the county really is responsible for the licensing, the permitting, and overseeing the compliance, if you will, of those regulations. Next slide. I think that's really the big takeaway, not only creating and standing up that licensing and permitting process, but ensuring ultimately compliance with. So ensuring providers are compliant with those regulations, are licensed and permitted as they need for secure transportation services. Next slide. The regulations really, if you wouldn't mind going back one more, I think with the provider heading in red, perfect. The regulations that are housed at CDPHE that really kind of set the minimum standard of what counties must put in place really are very county specific. There's one section, however, that talks about the provider responsibility, and that kind of segues to what we'll be presenting today. The provider responsibility with regard to data specifically. So part 6 is where you'll see that talked about, where it really addresses data collection, the way in which that will occur by the licensee. And then it goes on to talk about that annual, or that reporting of data must be done annually for the year prior, again, no later than March 1st of each year. So that will begin in March of 2024 for the 2023 calendar year of service. We are obligated by statute to collect that, summarize that, and make it publicly available by the 1st of July that following year. And we will really, the way the language reads is that it's to address or to summarize, if you will, the utilization of the service across the state. So that part in particular is kind of what we're talking about today, is how that's to be provided and what our responsibility will be. Next slide. These 2 slides, thanks, Megan, ultimately just distill what the regulations say and what it is that has to be submitted or collected as part of the data components of the secure transportation services. So total number of transports, some of the age demographics, type of location where individuals were picked up and dropped off. Next slide. It also talks about number of individuals who have maybe been transported more than once. So again, trying to distill or understand the utilization across the state, where it's occurring, and maybe the percentage of transports that are for persons who have utilized the service before. The latter part of the regulations here, F, G, and H, really talk about some demographic data. And then H is trying to distill those folks who access this service who are not on involuntary holds. So that's just at a high level, what is distilled in the regulations for this data piece. Next slide. And I think this is where I will be handing it over to Amber to kind of walk us through the timeline and really then what this process looks like for the submission and receipt of data.
Yeah, thanks, Kara. Just to reiterate some of the pieces that she already touched on. So beginning of this year, it's possible that transports could occur. And the idea is, the reason we're reaching out right now is that if folks need to submit their data in March 2024, they need to be collecting the data now. So we want to ensure that you have all the right tools, all the questions answered as far ahead of time as possible. So come, February 14th, we're not necessarily getting a million questions and you have to back populate all the data. So we're trying to get ahead of this, make sure that folks understand what it is that they're going to need to document every time they provide this service. So again, this year's data will be required March 1st, before March 1st of 2024. And then my team is the chosen people that get to summarize and make publicly available the data for everyone else. So that's why you get to hear from me today. Next slide. So essentially what we've done is taken all of the required elements per stated in rule and translated them into data elements that folks need to enter for every single client. We tried to make it as simple as possible and as standardizable as possible. So we built a very fancy spreadsheet. All the columns are locked. There are 14 columns, which represent, as I mentioned, the previous data elements that Kara mentioned needed to be collected as part of this regulation. The idea here is that each row is intended to signify one client. And working with data in the past, I'm sure many of you know that one of the key principles to data collection, especially when it could involve sensitive information, is really the minimum necessary to do our jobs. So that's what we've really tried to embody here, is what is the minimum necessary information that we need to collect to withhold the rules and regs that we discussed earlier. And again, it's locked to standardize, so you can't rearrange the columns, rename the columns. Full disclosure, this is to make our lives a lot easier as we get all of these spreadsheets in from Secure Transportation Services. We can easily aggregate all the information in a simple, standardized way. So you'll see here there are some parameters already set up. Wherever we could, we tried to make it simple and straightforward. For example, like race is shown here as a multiple choice question. So rather than having one service, answer the question Caucasian, and another one answer white, and another one have misspellings, we've just tried to simplify it and make it a lot more standardizable. So go ahead to the next slide. Another piece of information that we have learned is really helpful over the years is to supply a data dictionary. Sometimes the name of the element alone in a column isn't enough for someone to understand what is it exactly that we're asking and how do we need to enter it. So we also put together a data dictionary that has each one of those columns kind of laid out and specified so that each user understands the expectation of how the data should be entered, what we're asking for in the specific column or data element, and other pertinent information, sometimes pulled directly from the rule. And again, it's to standardize, it's available to download, and it also defines all of the appropriate responses for each of the data elements. Go ahead to the next slide. So that brings us to the submission process. So we've told you what data you need to collect, where to enter it, and now the last piece is how do you get it to the department? So here we've outlined the steps for submission. And because this does include potentially identifiable information, we've taken all the appropriate precautions to be sure that the data is protected and locked down and encrypted when it comes to us. What we found in the past is sometimes our EMS agencies or hospitals don't have knowledge of the most up-to-date encryption methodologies. So the department actually built an interface so that anybody can encrypt their data when they're sending it to the department. So that's what this system is here. There's a link, thank you, that's been shared. That is this department-wide resource. It's available to the public. So you go to the link, you enter, you register your email address and set up a password for the email encryption account. Then you just construct the email as you normally would. You create new message, you fill in the to address, the subject, and you attach the spreadsheet. And then you address your email to our secure transportation data inbox listed here and click send. So with that, go ahead to the next slide. I think we are here to answer any questions that you may have. And I think that's all I have from a data perspective.
Thanks so much, Amber. And I'll just underscore, obviously this is, I'll say dynamic or interesting as legislation goes for implementation, right? CDPHE wrote the regs, counties license and oversee and regulate, all the authority sits there. HCPF is doing obviously the kind of reimbursement package. And then we have this once a year data piece. So we will certainly rely on kind of all of our communication vehicles for some friendly reminders as this deadline for next year approaches, be that through HCPF, through our sister agencies, through the county authorities that are really undertaking that licensure and permitting process, and or say CCI or others. So it won't be the last time that secure transportation providers hear from us on this. Megan, if it makes sense, I'm happy to just go through some of the questions that I see in the chat and then open it up for others.
Yeah, I think that makes sense. Do you want to just start at the top? I did already accidentally answer one, so I can read that one out to you first, if that's okay.
Hey, if you're already doing it, that sounds great.
Well, I accidentally answered it with the wrong answer. But Tammy is wondering who will be responsible for collecting the data, and will it be the private secure transportation companies?
Yeah, thanks, Megan. So those that are responsible for submission of this data are those individually licensed secure transportation providers. So be that someone on the behavioral health kind of industry, be it a private security company or others. Ultimately, it's anyone who is licensed and permitted within the county to submit that data.
So the data is coming directly from the provider to CDPHE, or does it go through the county?
That's right. So I saw Elizabeth's question of our providers sending that directly to CDPHE, or is that going through the ASOs or the county authorities? I think it's an interesting relationship because it's CDPHE that needs to collect it. That email address is us, and we are responsible for making it publicly available and kind of co-leading of it. So those providers will submit it directly to us, to CDPHE. Pardon me. That said, if there can be a collaboration of clarity of the expectation, either from ASOs or reminders from the counties who do that licensing and regulating, that's obviously important and really helpful. But yes, the kind of conduit will be directly from the provider to CDPHE.
And I also just want to clarify too, also like ASOs and RAIs have some responsibilities, but there is nothing seemingly written that indicates that a secure transport provider has to engage with ASOs or RAIs. Is that
at least not
your
within
understanding
any
as well?
of the, yeah, at least not within any of the statutory language of this bill, nor the CDPHE regulations.
Okay. Cool.
Amber, you and I can tag team this one, but where do we find the spreadsheet and how can that be made accessible?
I think maybe some feedback from this group would be helpful as to the easiest way to answer that. I think we've explored a few different options, whether that be some sort of folder that is hosted with CDPHE. If it's a resource that we could give to the counties directly, I think that would be ideal. In the meantime, I think folks could reach out via that secure transportation data email, and we can send it that way. Kara, other ideas there?
No, thanks, Amber. I think the only other thing is, yeah, Amber and I had talked about, while we had been reticent to have too much permanent on our website around anything other than just the general rulemaking process, because we don't continue, if you will, to oversee or license this service. We will certainly make kind of a data landing page that talks about that responsibility, provide the spreadsheet on it, any of the kind of instructions, data dictionary, so on, for that piece as well. So that'll certainly be forthcoming. I think the next question, hopefully we answered. Abby, you asked, the data collection mentioned is only for secure transportation providers, correct? Which is correct. Again, the providers are responsible annually to submit this general utilization data to CDPHE. And you ask, what are the data collection requirements for licensing and permitting authority? The counties themselves don't have a reporting responsibility to CDPHE. It is the provider. The statutory language, I think the intent was just, we've never had a picture in Colorado of where this service is being provided or by whom or any general information about it. If there are service gaps, anything of that sort. So that's really the intent. And it was a very succinct, short statement around annual data collection from the providers to CDPHE and make that publicly available. So there isn't anything that the counties, if you will, have that are data collection specific, with the exception of, just from a partnership perspective, any iterating of this expectation to providers from the counties doing the licensing is greatly appreciated. The next question came from Greg. This reporting is not required for ambulance companies, correct? Monica, I'm gonna kind of come your way here in a second. You can keep me on track. The statute does indeed give an exception for licensing and permitting for licensed ground ambulance agencies. If they are going to continue to provide the service and they are already a licensed ground ambulance agency, they do not also have to get licensed and permitted in the county for this service. That said, if the ground ambulance agency, there's kind of two pieces here, wants to seek reimbursement from healthcare policy and financing for this service, the county does have to ensure compliance with those regulations. So that doesn't mean they have to license and permit that ground ambulance agency or say that individual vehicle, but they have to have some review process or kind of regulatory process that ensures compliance with that for the reimbursement piece. As far as the data component, while ground ambulance agencies are exempt from licensing and permitting, they weren't made exempt from the data collection piece. CDPHE remains obligated to paint the picture of implementation of the service, if you will, across the state. So we also took that in mind and really tried to streamline what that submission process looks like so that it is, hopefully as user-friendly as possible for ground ambulance agencies as well. And again, that's just that once a year, but separate and distinct from your EMS reporting that you have elsewhere. Monica, anything you would add or I'll say even correct on that piece?
No, I think you got it. You're good.
Thanks for keeping me in check.
Yeah.
And then Megan, this may be a question for you, as CDPHE is certainly not the guru or expert on anything ASO or RAE wise, but will you remind us what the ASO or RAE requirements are in regard to this service?
Sure. Right now, there is no requirement that secure transportation providers have to engage with ASOs and RAEs. And I think that was taken from trying to figure out like what's already happening. But I do recognize that RAEs and ASOs do have some relationship with HCPF and BHA as to how we would like things to go. But right now it's not clearly written as an expectation for participation. Of course, we do want to encourage collaboration wherever we can. And I hope to have more information for you as the benefit goes live and as we're developing all the processes of the benefit. The other question that was in there was, what are emergency service patrols? We have a definition of emergency service patrols. That was one of those CDPHE exemptions. And I don't know if you want to speak to that, Kara, or.
Yeah, I can likely tag team it with Monica. I don't think we have anything too significant more different to add than what is in the statute. I know, Megan, you were also inquiring of that, of the BHA, if I recall, if there's any additional clarification. But I can drop in the emergency service patrol kind of reference and what it articulates. But that was ultimately, the statutory language allows for called out those 3-4 areas of exemption. And so that was ultimately articulated almost in a verbatim manner. I realize that may not add great value to the answer to the question here. Monica, anything more different to add? Otherwise, I'm happy to also drop in the language.
Yeah, I think if you could add the language, I mean, that's really all we have, and it references the BHA and then working directly with the local counties and cities. So I think, yeah, that's all we have to share, unfortunately, on that one.
And
Go ahead.
I think from, I have been in contact with BHA and they're in the process of rewriting their rule as new organization. And so I have highlighted that to their rule writers as something that they have written before. And so that definition would be theirs to define. And so I can connect you with the person over at BHA who's working on that if needed. Okay. There are a few other questions regarding the data collection that I just wanted to call out. I noticed the county is not listed on the spreadsheet. If a transport provider covers multiple counties, do they need to submit one report for each county, or do they aggregate the data and submit one report per transport provided?
Thanks, Megan. Appreciate that. Amber, feel free to tag team this with me. The data is by provider, not by county. So there are zip codes for pickup, if you will. And so it's reasonable that if a provider is licensed and working in multiple counties, there will be multiple different zip codes, if you will. And so it'll just be one submission reflective of whatever catchment areas that provider works within. Amber, anything you would add from a data perspective or to correct there?
Nope, you nailed it.
Great. And I see Greg's question. Is there a person we can contact to discuss reimbursement? And that would be me. So I will send you my email and we can set up a time to meet. I will move on to the next portion, which is just like a reiteration of the reimbursement policy from HCPF side, unless there's any final words that you have, Kara, that you want to.
No, I think that's it from CDPHE, and we will certainly communicate more as this first data collection round approaches basically next spring. So yeah, thank you all for the opportunity to share. Appreciate it.
Perfect. Okay, so just a reiteration of what we're doing, what we're working on here at HCPF. Oops, okay. Apologize for my slides. So behavioral health secure transportation, loosely defined because our rule is not public yet, is unscheduled urgent transportation to members in behavioral health crisis. We are going to align with current mileage rates, which are set by the federal rates, and that would be at $6.10 per mile. And that is inclusive of when the client is riding in the vehicle, which is traditionally how transportation services are reimbursed, such as ambulance services or non-emergent medical transport. When the rider is in the vehicle, that's when per mileage can be billed. The other rate that I wanted to talk about was our A0999 code, which will be used as a base rate. So upon behavioral health secure transportation going to a site and then picking up a client to provide transportation, they will be able to bill that base rate amount as well. And that base rate is aligned with NEMT and EMT base rates. It's an average of the base rates there that are utilized for various staffing ratios and stuff like that. So if you have any questions regarding that, I would love to know your comments if this seems reasonable. Again, these are preliminary rates. So any input that you would like to include now or make us aware of. We recognize that vehicles need to be aligning with CDPHE rule in order to get permitted and licensed appropriately. Staff need to be licensed appropriately. And so a lot of thought went into this base rate, and I just wanted to see if anybody has any comments on that. I'd be happy to take them. However, moving on. So this is what it's going to look like in practice. So you might have somebody who has a behavioral health crisis and they can utilize another type of transport. That type of transport that they might utilize is emergency transport, family transport. It's possible that law enforcement might still be willing to transport if they're like a co-responder kind of model or something like that, but that might not be reimbursable if it's a law enforcement transport based on CDPHE rule, as we recall. So there are other types of transport out there, but behavioral health secure transportation is creating another option. And so you can take that behavioral health secure transportation to a facility, which might result in an assessment, might result in a higher level of care, might result in necessitating another behavioral health secure transport to another higher level of care. So that would be that secondary facility. And then to get our client or member home, you can utilize the already existing benefit of non-emergent medical transport. And that is currently utilized in some higher level of cares to get people home and so on and so forth, or to a lower level of care. If you're not familiar with the NEMT benefit, I'll talk a little bit more about it. And I'll provide you some a resource on that as well. So our BHST implementation timeline is moving forward. So we have a July 1 deadline that this needs to be, is legislatively mandated to be funded. And we are in the process of preparing the rule and state plan amendment. And that we're aiming to go to the MSB in February and then be on that timeline. And so sometime in March or April would be our first reading. And I'm kind of leaving it vague because I'm not sure when we'll be able to get on the agenda, but we are prepared with our documents and sending those to MSBs so that they can get us on their schedule. And at that point, it will be open to public comment, which I invite everyone to please do comment on the HCPF rule for reimbursement. We want your input and recognize this is a new space. So our current responsibilities is the counties are ensuring compliance with minimum standards and licensing secure transportation services by January 1st, 2023. So that date has passed. And so that's what the counties are responsible for doing at this point. Right now, as I mentioned, we are moving towards our medical service board review of our rule. And opening things for public comment. CDPHE, as you can see, is working hard on their data collection and getting that information out to everybody and on what the requirements are for secure transportation providers. And secure transportation providers are obtaining appropriate licensing and permitting for each county in which they are picking up folks. One option was to that I want to put out to secure transportation providers is that you might want to enroll your staff as non-emergent medical transportation providers in order to provide that round trip, that return trip home. I know I've talked to a few secure transportation providers that is their common practice and they would like to continue to provide that service and that continuity of care, in which case there is available option that's already available, NEMT, and I can certainly help you connect with the Medicaid resources on that service. Here is a link to the non-emergent medical transportation resource. And the main difference, there are a few other nuances, but the main difference that you'll see in provider requirements for behavioral health secure transportation and non-emergent medical transportation is that non-emergent medical transportation is required to have a BLS whereas BHST requires providers to have CPR and first aid. Now, BHST also requires trauma-informed care, cultural competencies, and a few other things that are very clearly outlined in our CDPHE rule. But this was a nuance that I wanted to make sure to get out to providers in case they did want to capitalize on that NEMT transport reimbursement option. And you can enroll with that now. So I know that everybody's pretty busy probably getting all their ducks in a row with the BHST licensing and permitting, but if you've already had that done, you can also certainly move on to that, to trying to build that third leg, which would be the non-emergent medical transportation. And that's something that is already an active benefit that can be billed now. The BHST benefit will not be available until July 1st, but just putting it out there. Here are our resources. Check out our HCPF website, where we're hosting all these other resources as well, links to that. And we'll be posting a link to this recorded presentation and the presentation materials. Colorado County Incorporated also has some really great materials on their website, and they're hosting some materials that might be helpful to each county in their licensing and permitting provisions. Next steps. So we'll hold another stakeholder meeting on February 21st from 11 a.m. to 12. At that point, I'm hoping to have a Medical Services Board update from HCPF's side. So I'll be pointing you to when you can when and where you can provide public comment on our rule. Here's the registration link. And if you would like to fill out our engagement survey, we'd love to hear from you. I have one request. I have been trying to collect county contacts. Here are the counties that I do not have. So I have about 25%. I have contacts who are the licensing and permitting contacts for that county. Just because a county is listed doesn't mean the resolution is not on file. I just don't have an actual person that I've been able to talk to about it yet. And so if you are able to, or you know the person who is your county, who is managing the licensing and permitting at any of these counties, please do reach out to me. I will drop my email in the chat, and I'd love to make sure that I can collate that list. The purpose of this list is to help providers who are new to this field. I recognize that we're kind of building a new-ish workforce. Like this work has already been being done, and we're kind of including this like whole reimbursement strategy that means that we're bringing people into maybe a gray area that they haven't really been in before as far as reimbursement through Medicaid. And so I want to be as helpful to service providers as possible. And so I wanted to create a county contact list so that we can be as available to supporting our service providers with this information as possible. I recognize that there are some questions in the chat, so I will try to answer them. Elizabeth is asking, is anyone with UPass RID in the meeting? And I don't know, but if you are here, you can raise your hand. And if not, I can try to connect Elizabeth and my UPass contact afterwards. Anonymous. The closest transit is 4 hours away from us. I don't think this base rate would incentivize people to take on a transportation contract. Of course, what would be ideal is to have people who are contracted be closer, which is the aim. Totally. So again, I think this speaks to like recognizing the newish workforce here. And if this anonymous attendee wants to check in with me or contact me, I'm megan.morrissey@state.co.gov, which I will drop in the chat. And I am happy to have this conversation to try to figure out what will work for you on a local jurisdiction level. Yes, we are recognizing that it may be challenging for some of our rural and frontier partners. And so if we can find ways to incentivize the workforce, which we know we are already facing workforce challenges in behavioral health and medical care and healthcare in general, I would like to find ways to do that. So please feel free to reach out to me. We can set up a one-to-one, whatever works best. I want to hear from you, and I want to hear what the issues are so that I can try to plan for them. I might not be able to solve all the problems, but at least I'm happy to see how we can be useful to a local jurisdiction. Is there a plan to cover transportation for indigent clients? Great question, Jennifer. I can only speak to HCPF and Medicaid dollars. However, we are partnering with the BHA, and as is tradition, kind of, you know, if HCPF will create a benefit or BHA will be creating a benefit, we are working really closely together to try to figure out how this can be supported, because it is legislatively mandated. And so that legislation does not specify for a specific type of insurance provider. And so I can only speak for Medicaid dollars, and at the same time recognizing that we have a whole state to cover. So we are working with the BHA. We are also working really closely with Mobile Crisis Response, who will be operating in the space as well. And 988, we know that there's a lot of things that are rolling out at the same time this is rolling out, and we're tracking all of those interactions. So great question. Don't have a good answer for you yet, but that doesn't mean it's not coming down the pike. Elizabeth, I will send you the links for the NEMT slide for sure. And any sense on how much others are charging for a license, permit, and renewal? Well, great question, Lori. In some of my research, I found, I'm just bringing it up here right now. I found a variety of different prices. I found one county that was charging $1,000, but I can't speak for what exactly that was or even what that county was. I saw other counties that were charging like 200, maybe 100. It depends on like the licensing and permitting, and it's up to the counties to set that rate. So they're allowed to do a variety of different things. Regarding, I don't know if anybody wants to raise their hand and tell us what you're charging. CCI also had a couple, is hosting a few different counties licensing and permitting documents, which also has the fees schedule on there. So it seems to be a huge range. And okay, so Elizabeth is saying, Lori, we're hearing 400 per vehicle. So there is a big range, and I have been hearing from secure transportation providers that this is challenging because it can be cost prohibitive because they need to be licensed in any pickup location per CDPHE rule where the client is based. And so I think in the past, CDPHE, and correct me if I'm wrong, Kara, but we have talked about that there is an allowance for reciprocity agreements. And so encouraging that across counties might be helpful in getting secure transportation providers into the workforce and making it less cost prohibitive. So that is a concern that I'm tracking as well.
Yeah, thanks, Megan. You're right. The CDPHE regulations certainly provide counties the authority and option to utilize reciprocity agreements for providers that are licensed and permitted in other counties for some of those, if you will, administrative efficiencies. So yeah, you're certainly on point with that statement.
Sorry, I realized I was talking on mute. Okay, so I just put my email address in there in the chat. Please feel free to reach out to me. I'm happy to try to problem solve, try to figure out what's going on for your local jurisdiction and see how I can be useful and helpful. I also, oh, I see another couple questions popping in here. So let me just wait. I also put in the wrong email address. So here's the correct email address because I have a lot of them. So it's Megan Morrissey at state.co.us. So please reach out to me. I'm happy to schedule one-on-ones. I see that Scott has placed in the Q&A, Montrose County is 200 per license and 100 per vehicle. and we have utilized reciprocity for other counties. Cool. So I think the benefit in getting into the reciprocity game is for counties who don't have licensing and permitting like readily available or the staffing to do that. They could utilize those reciprocity agreements. And for those that do have all of that stuff, they might benefit financially from doing a reciprocity agreement. Jen says, I can't recall if this has been asked previously, but are you in the communication with the Division of Insurance regarding adding this as a benefit under commercial insurance plans? Right. So yes, that's on the radar. Am I in communication with them directly? No, not yet. It's transportation such as non-emergent medical transportation is sometimes not provided under commercial insurance plans either. And so I'm going through and working with some colleagues to try to figure out what the best way to approach that would be. Not only do we have, can I only speak for Medicaid, but I also am working with BHA to cover those folks. At the BHA, there is already some general disbursement funds available to ASOs and CMHCs. I've heard it's not been super utilized. And so I can certainly connect somebody who is a behavioral health secure transportation provider already, who's working with a CMHC or an ASO, because there is money already available for that. So I can connect you with that person if that's something that would be helpful for a secure transportation provider business or anything else that you're working on. Yes, so I have not been in contact with them quite yet. Getting my ducks in a row and then hopefully plan to, because this is a new space, right? There's only a few other states who are even broaching this type of provision benefit. And so we're hoping that it will show how useful it is and that other commercial insurance plans will want to get into this service and providing this service and see the benefit that it brings to our members. Thanks for that, Jen. Katie, do we have any more clarity on if private insurance providers will be paying for secure transportation? And I think that is similar to Jen's question too, which is like the commercial insurance plans. And so I don't have any more information on that right now. I will try to dig deeper and try to move that question forward. I don't have any control over what other insurance insurance companies do, but we will try to engage with DOI on that particular topic. Megan, Elizabeth, are you talking about the 30K designation for each region? Megan Lee would know if it's the same thing. Yeah, Mary Heffler is actually running that general disbursement fund. And so it is a attachment from an ASO, I believe, but I don't want to speak out of turn. So I will connect you with Mary on that, or you know Mary as well. So, but yes, that is still currently available. So that would be some, yeah, okay, cool, awesome, great. Thanks, Elizabeth. Okay, awesome. So just recognizing the time here, we're doing good. Okay, great. So this is our last slide. So please reach out to me. John Lentz is my supervisor. Megan Lee over at BHA can answer some more of those questions regarding how BHA is interacting with behavioral health secure transportation and those rules. So I have not forgot about your question, Katie, about the emergency service patrol rule. And then you can reach out to Kara or Monica regarding CDPHE rule or for clarity on any of that. And then for MCR questions, mobile crisis response question, you can feel free to reach out to Emily Holcomb or Megan Lee, who are heading up that project, knowing that we are interrelated. And so if there's anything that kind of is sticky or seems like it might be a sticky issue for your jurisdiction, please reach out to us. We're happy to connect. And then for the NEMT questions, that benefit is run by Courtney Seaton here at HCPF. And she can answer all your questions. If you're a provider and you want to get enrolled as an NEMT provider and start billing Medicaid for that return rate, return trip or return leg. That's what I was trying to say. Please feel free to reach out to her. She is also always looking for providers. And we recognize that we are kind of building a new-ish workforce, and it might be a bunch of different types of people who are coming to this field. So yeah, we welcome any and all questions. With that, I don't see any more questions, but I'm happy to give back 10 minutes and get people headed home, hopefully safe and sound in the pending storm, although it hasn't started snowing here yet. So any last minute questions? Alrighty. Well, please reach out to me, email me. Thank you. Thank you for coming. Thank you for engaging in this. I know it might seem a little messy at times, but we'll get through it, and I'll try to answer anything that I can. And Shay, I will give you that recording as soon as it is ready. Okay, it'll probably take at least 24 hours to get it done, but I'll get that out to you for sure. All right, please feel free to reach out. I appreciate you all. Happy New Year, and I will see you in February.